Hi, welcome to Golden Years. I'm Lori Betts. This month I will be interviewing Sean and Laura from the Office of Older Adults. So come on back and you'll hear everything that's going on there.
My Shiro doesn't always wear a cape, but she always has time for a hug, a smile, for going the extra mile. My Shiro stretches every dollar, puts in long hours, puts others first. But now it's your time, Mom. When you're ready to retire, we want you to be able to enjoy it. It's time to start saving now. A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today. Visit aceyourretirement.org.
You're watching The Bat.
With Julia's autism, loud sounds can be too much.
But she still loves to make music.
Yeah.
Play band.
Early screening for autism can make a lifetime of difference. Find out more at screenforautism.org.
This month I am interviewing Laura Toth, the Director of Office for Older Adults. And we also have Sean Parker with us, and he is the Program Coordinator. So thanks for joining me this week.
Thank you so much for having us.
So the reason I wanted you to be on my show, because the poor seniors are at home. They're waiting to find out when they could get out of their homes and get back into the real world. But until that all happens, I know you are thinking out of the box, and you guys have come up with some creative ideas to keep these seniors active.
Well, we have a lot of activities that have gone on for the past 10 months during this pandemic that we've never done before. We've certainly, out of the box thinking, I think is the correct term. So we've certainly done a lot of that. Seniors are in their homes, so we had to figure out how to get services to seniors who were not going to leave their homes. So we came up with a few things. The first of all, one of our biggest programs here was a meal. People could come every day for lunch and enjoy a meal service here at the agency, or in Brunswick at the Brunswick Rec Center, or in Wadsworth through the restaurant voucher program. But all that ceased to exist in the middle of March. So we had just amped up our meal delivery service. We reached out to seniors who were on all these programs and asked them to come on the meal delivery service so we could deliver a meal to them at home. It's certainly not the same. It's not socially the same as being able to come in and sit with your friends, but people are getting the nutrition they need, and they get the contact of somebody saying, "Hi, how you doing?" every day. So our meals went through the roof. We delivered over 67,000 meals in 2020. And just for comparison, in 2018 and 2019, it was around 38,000. So that was a huge increase. Yes. And it was kind of an all hands on deck operation. I delivered meals, Sean delivered meals, everybody delivered meals, and still do. We went from 6 meal routes to 10. So we are still, covering the whole county. And getting nutrition to the seniors that need it. So by far, that's been the biggest program that we've been able to continue throughout COVID and with the restrictions.
And when you deliver, I want to cut you off. When you deliver the meal, does Mrs. Jones want you to stay?
Yeah, sometimes, yes. And some of it's kind of an art. If some people want to engage and talk, you want to, hi, how you doing? How's everything going? But then you have, more meals to deliver. So it really is, our staff is very good at talking enough and being able to then move on to the next delivery. That's a really good question, Lori, because people are lonely. They want to talk.
Because a lot of people, that's the only people they see. Person knocking on their door. Because if they're not seeing their children, visiting with neighbors.
Yeah, it's been really tough. So we've tried to respond. The other big program that was just created in at the end of March, beginning of April, we partnered with Bueller's, all the Bueller's in the county, and we have a volunteer shopping program. And even though there's not a Bueller's in Brunswick, it does cover Brunswick. We have plenty of Brunswick clients on this program. And basically, what it is they seniors are hooked up with a volunteer shopper, and they give their list to that shopper, and then the shopper goes to Bueller's and gets whatever they want. And then Bueller's calls the senior to take care of payment, so the volunteer never gets financial information. But so the groceries are then paid for. You know, and then they get delivered to the senior. So it's just what they want. Sometimes people are really specific and sometimes they're general, but we have 265 seniors that we're serving on that program and about 75 volunteers. And that's all since March.
Okay, how many volunteers?
About 75. Yeah,
Wow.
everybody has 2 or 3. Now, some people only need that service once a month, but some people need it every week. So it just kind of depends.
Do they get to use and see the same volunteer, or is that hard to do?
Yeah.
Oh, there you go.
Yeah. Every volunteer gets 1 or 2 seniors. Yeah, and then that's their people.
Oh, that's good.
Yeah.
That was a good connection.
Yeah, it was.
Was that your idea, or did they approach you?
It was our idea. Yeah. So we
Very
approached
good
them,
idea.
reached out, and we went to several shoppers. Grocery store chains and whatever. But Bueller's was like, absolutely, let's make this happen. So it worked out great. We have a variety of activities that we do through Zoom, and I know some
Oh, I was
seniors.
going to ask you. That's on my list.
Some seniors are scared of kind of that technology, and we are working with the library now to we have a mini grant through Senior Services Network, and we are getting more people to be more comfortable with technology. So if anybody's interested in learning more about Zoom and how to use it, not only to connect to our classes, but you can connect to your family and friends that way, I would encourage them to call the office, because technology is something that can be scary for people, but it's just so important, and it's such a social connection for seniors who are feeling trapped at home.
Oh yeah, definitely.
So we have that, and we have the Senior Talk. That's Medina's newsletter. And then in Brunswick, it's called the Senior Spot. And Wadsworth Suprema Center also puts out a quarterly newsletter. So everybody in the county should have access. They're online at mcooa.org. And you can click a link and get the newsletters and get up to date with what program is going on. But our in-person program, Lori, which is where you started, we bought an FM system, kind of like if you think of a drive-in movie. So we do have what's called parking lot bingo programs that we are operating. There is one in February that we'll do in Medina, and one in March that we'll do in Brunswick. And people come and they drive to the parking lot, and it's going to be cold, so the staff will all be, I'm sure, bundled up. But they drive to the parking lot. They'll be able to tune their radio to the bingo caller, which is the staff. We have the technology to do that. So then everybody gets cards and little bingo dabbers, and we play bingo games and have prizes, and we have sponsors that bring in prizes. It's a lot of fun.
Wow, that's pretty neat.
And the other thing we're doing, if people can keep their eyes peeled, we'll try and get the word out either on our Facebook page or through Brunswick Area Television or anywhere we can get it. We're doing a drive-through trip brochure pickup, and that will be in the beginning of March. It's going to be on the same day at the same times in either Medina or Brunswick. You can drive by our office or drive by the rec center, and we'll be able to hand out trip brochures car by car.
Do you have a crystal ball?
I do not have a crystal ball. I wish I had a crystal ball, but we are scheduling trips starting in May. And if we have to cancel, it will be month by month. So right now we're scheduled for May. Probably by the end of March, beginning of April, we'll know if May's programs are going to go. And we'll just kind of
But you'll
go
have
month to month.
Okay, but you'll still have to do limitations, you think?
Yeah, with
As
the
far as
trip
people
company.
going.
Yeah, with the trip company, there, our activities coordinator has worked that out. You know, as far as how many people are allowed on a trip and things of that nature.
And it's an attempt to move back to normal. You know, everybody is so tired of being cooped up, and it's the same four walls all the time. You know, so any activity or any hope for the future that things might change, it helps to brighten a person up. You know, when we were talking about some of the different trips with some of our regular seniors that come to the senior center, they were like, "Oh, do you think that's going to be possible?" And you could hear the inflection in their voice of, "Man, that'll be great if that happens."
Do you have like a calling list? Like call the people every couple weeks or so just to check in to say, hey, how you doing?
Yes, we have coordinated again with Suprema Senior Center. We do a lot of things together. We have a friendly visitor call list. Again, that's a volunteer program. Each one of our volunteers has between 5 and 10 people they call. And then it's up to the senior, either on a weekly or every other week basis, to say, hey, how's it going? How are you surviving this week? Is there anything you need? Just to make that contact again with the seniors that are out there. And there are, I believe, about 120 people that are getting calls from us.
Very good. What happened to the pool guys?
What happened to the pool guys? Well, I will tell you this. The pool guys, we do keep in contact with them. We hear all about it because we do have 3 pool tables here. But when they come back, they're going to be in for a shock because we have painted and we have new carpeting and we have redecorated the pool room. And so, as well as the rest of the agency, the rest of the senior center, it's totally redone. So we're excited for everybody to come back and see it. But those pool guys are going to be impressed with what we've done with their area.
Oh, that's awesome. I can remember the days when I would come through there and they were like serious pool players.
Yeah.
You know, they would say hi, but don't bother them.
That's so true. But we miss everybody that comes to our center. We miss the pool players. We miss the women who come in and gab with their cups of coffee every morning. We miss the people coming for activities. We had no picnics last summer.
Yeah.
Who knows if we'll have a picnic this summer? So it's been really difficult. And I know those seniors are out in the community at times. I've seen seniors in the grocery store and I can like feel it in my heart. It's like, oh my gosh, I miss seeing you every day.
And it's talking about your picnics. How many people do you expect? You back in the day? I know because it was growing every week because you had more and more people coming.
Oh yeah, those events were around. We'd have around 100, 120 people come to the event, so they were really popular. And I can't wait to bounce back and get the word out there and say, hey, we're having another big event. It's just going to be a while.
Definitely. No senior day. I can't see that happening.
No, there's not going to be an event at the fairgrounds. I can't, but maybe we'll do some kind of like special bingo or something like, parking lot bingo like I talked about, or something to celebrate seniors in the month of May.
And you can't even open up your building to have like a handful of people, can you? Or do you? Or no? Or
correct. Right now, I'm really glad you brought that up. Right now, we are under a state mandate to test staff and people who would come to the center if they're symptomatic every other week. Every other week, we would have to test staff and seniors. So right now, and we have been working since September to see if we can make that happen. The biggest reason that can't happen is because we don't have a doctor on staff who will order tests. It's kind of a really complex system, but you have to have a healthcare provider order a COVID test. And we don't have that. We don't have any pharmacists, we just don't have that on staff. So really the majority of senior centers in Ohio are not open because of that mandate. So we are trying to work with, we were working and are working with the state. They have some state administration of testing, but we haven't been able to coordinate it. And now I'm working with a place in Cuyahoga County to see if we can coordinate it, to see if we can even open up for a few activities. Because that's what we were looking at, this kind of slow open. Let's get a few people in here, air out the space, bring a few more people in. But it hasn't been worked out. But I don't want the seniors to lose hope because we are working on it. Something will give. And you will see the inside of a senior center this year. The Brunswick Rec is a little bit different because they are open and they do have the Silver Sneakers going on. If you're a Silver Sneakers member, they do have those exercise activities, but we still can't have our senior programming. So that's kind of weird. We do have a new staff up there and she couldn't be here today. Her name is Darlene Jarvis. She's just wonderful. She's actually been here since last March, the week after we closed. She started.
Wow.
So, I know, for a time, the Brunswick Rec Center was closed, and we were so busy with meals that Darlene just drove. She drove full time for probably 2 or 3 months until Brunswick Rec opened back up and she could get back into that position. So she's anxious as we all are to be scheduling programming.
Well, that's good. But at the Brunswick Rec, they don't hold anything there for the seniors other than Silver Sneakers.
That is correct. There's no programming right now.
Okay.
Except for now, we did have the parking lot. I'm sorry. We did have the parking lot bingo there.
Okay. And how did that go over then?
It went over great. And we plan to have the trip brochure drop off at the Brunswick Rec. So there's very small, limited, once in a while programming. And then the Zoom programs that Darlene is hosting every week as well.
And how many seniors join that Zoom meeting?
We have anywhere from 10 to 20 at each.
Wow, that's pretty good.
Each meeting. There's some that are super popular that we coordinate with Wadsworth. We have Cindy McGowan is a local therapist, and she does a Make Me Happy Hour. It's called.
I just heard about that.
Yeah, and that's really popular. I think they have 50 people there. So some of them are quite large.
That's good. You have to keep them engaged. And like I said, you guys are thinking out of the box and you're putting your thinking caps on and you're being creative.
If Sean could talk a little bit about what we've done for not only meeting benefit needs during this time, but also a really popular question is what's going on with taxes?
So right at March until right up until open enrollment, we were able to kind of see folks by appointment face to face with a lot of the safety precautions in place. But come October, right there by open enrollment, we ended up having to shut our doors. So that being the case, we had to become creative with doing virtual calls and phone calls to help people with benefits, Zoom meetings to kind of do just general explanation of Medicare programs and health information. Everybody would call us up or would come and see us on a regular basis because right around that time of year it was, hi, you could get free medical services by just giving us your phone number, and everybody's like, well, what is that all about? So for us, it was commonplace just to be able to explain all of that. And the transition from meeting someone face to face to using that technology, that was just a little bit of a struggle because not only did we have to get adjusted to that, but so did the seniors. So we were able to provide a lot of benefits to a lot of people that we had in the past, just over the phone or by walking them through things step by step on a Zoom meeting like this. So it was great. Benefits, open enrollment from October 15th until December 7th was still a busy time. It was a little different, but it was still a busy time. Then come January 1st, we started getting phone calls for taxes. So as you know, our office had partnered with AARP in the past to help with their free tax service program. And what happens is our office would schedule the appointments for Brunswick and Medina, and we would set up the appointments for all of their free tax service from normally from February until April 15th, the last tax day. So that being the case, this year it's been a little difficult. Obviously, with COVID being as prominent as it is, their venue has not changed. Thankfully, they're still planning on being at the local library, so at the Brunswick Library as well as the Medina Library. But it's also caused for some difficulties as well. I know that the Wadsworth area has not been able to come up with a venue right now to be able to do their program. So they may not be doing it, as well as some of the surrounding areas as well, like Strongsville. Their program has not been able to come to fruition. So we're getting a lot of phone calls from those people that are in just the edge of the county that would, most of the time maybe just go to Strongsville because they're in Hinckley or they're, just by that borderline. So they've been calling to see about appointments for Brunswick and Medina, to make up for that. So what I can tell people right now is, yes, they are still planning on having one. But right now, they're still working out the fine details. Their idea behind everything is more of a limited kind of touch system where you would provide your information. They would scan it. So they have, they've purchased a bunch of scanners. And then like a week later, they would be able to have your processed taxes done. But again, they were used to doing that face-to-face, same day kind of appointment. So they're having to adjust to things and we're having to adjust to things. And because of that, the timeline that we're normally used to has been pushed back a little bit. So we're still taking names for people, but we cannot give them a scheduled date or time because we don't know how many appointments they're going to have available to them.
Wow.
Yeah.
Who'd have thunk?
Right. So we are constantly. I think we're at about 400 people have called in so far.
Oh my goodness.
Yeah. Since January 1, they've been calling in, but since this last Monday here, we were just now starting to take names. So it has been crazy with that and phone calls about vaccinations and so with the governor sharing that the different area agencies would help out providing information for vaccines and so on. We have gotten an awful lot of calls in reference to that, and luckily, Laura and myself, we have a great relationship with the health department, and so we've been able to direct our seniors and the population to, the right information. It's been a true asset to have the director of that department, have the weekly newsletters or the or information bursts pop out for those, so that we can direct people directly to them. The latest one was yesterday, as a matter of fact, yesterday afternoon, where we were all alerted to the 13 or so different other places that you could go for vaccines. So it was a big help, because we can then direct folks to either get on those websites or call those different places in order to get the vaccines now.
And of course, the seniors don't like big changes. So, they want everything to run smoothly.
Right. And that's what we're here for. That's why our office, has been open since the very beginning. And, we have had such dedicated staff that have come in, rain, shine, or the snow and freezing rain that we've had, have come in, and it's been great, because we've been able to help people transition through this and to squash some of the fears that they have. I mean, with the different programs that Laura was able to help coordinate, with the shopping program, with the home delivered meal program, with and Laura did mention the callers that are doing the phone calls. But in addition to that, our home delivered meal program, it's a gatekeeper program. So we're also making phone calls every Monday just to make sure that those people on that home delivered meal are doing okay, because it's so easy to forget, okay, is today Monday or Sunday or Tuesday? I mean, sometimes I myself, if I didn't have an alarm clock and a calendar on my phone, I would forget, maybe I should be at work today, or something. So it's been great for those seniors, and it's allowed us to still keep in contact with a lot of those folks that have come in to the senior center in the past. So, we have been constantly active, answering questions from how do I connect to the benefits that are in the community to when's my stimulus check coming? So we get all those types of questions, and we don't turn people away. We make sure that we try and give them an answer or point them in the right direction.
So what do you guys want to leave with my viewers? I know, Laura, you said the phone number earlier, but just zoom through a phone number, a website, how they can reach you.
Sure. Our website is www.mcooa.org. And I would encourage you to check it out. And I hope that everybody stays safe and healthy and hopeful as well. This will, lessen. You'll be able to get back out in public. We're here to support you, whether you have to stay at home or whether you can come out. So thank you so much, Lori, for inviting us today.
Thanks for joining us on Golden Years this month, and we will see you next month, and maybe we'll have goals for more open.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask and let's beat this virus so we can get back to the things we love. Mask up, America.
Sorry about that. No, I've been staying at my dad's place because of everything.
Where are we going?
Navigating these times can be tough, but while you care for your loved one, you also need to care for yourself. Go to aarp.org/caregiving for free mental health and self-help tips.